Hi everyone, welcome to Ask the Horse Live. I'm your host, Michelle Anderson, Digital Managing Editor of The Horse. Tonight our topic is equine tumors, sarcoids, melanomas, and more, and it's brought to you by our sponsor, Kinetic Vet. Lumps and bumps on our horses can range from unsightly to deadly. They can cause a horse to lose value, and they can be painful, and we as horse owners usually want them to go away because we want our horse to be beautiful. To help us better understand the causes and treatments of common tumors, we're joined this evening by Dr. David Levine, who's a surgeon at University of Pennsylvania's New Bolton Center, and Dr. Susan White, who's an internal medicine specialist from University of Georgia. Welcome, doctors.
Thank you. Welcome, everybody.
Thank you.
Before we get into our full introductions on the doctors, I want to let everyone know who's listening that we have compiled resources for you at thehorse.com/skin tumors. We received a lot of questions tonight, and there's a lot of difference in tumors and variation, and so we thought that those resources would help you. If you don't find the exact answer you're looking for tonight, maybe those resources could help you out. And with that, let's go ahead and talk to Dr. Levine. Can you tell us a little bit about your experience dealing with tumors in horses?
Sure. So I've been at the University of Pennsylvania. This is my 13th year here as a surgeon, and I kind of do a lot of the tumor work in horses, and some of my research actually has been in treatment of sarcoids as well. So I spend a lot of time kind of on the front lines of the surgical treatment of tumors.
Okay. And Dr. White, can you tell us about your interest in dermatology and equine skin tumors?
Yes, I've been in the southeastern part of the United States for almost 4 decades now, and skin problems of all types are extremely common. I've had a long-standing interest in dermatology, and tumors are a quite frequent part of skin lesions that clients bring to veterinarians' attention. And I guess I would say that I'm more interested, or perhaps Dr. Levine is helpful in many of the tumors need surgical removal or surgical debulking. I'm probably more focused on mechanistic action of chemotherapeutic drugs and other treatments for tumors.
Okay. I want to give our listeners a quick review of the Ask the Horse Live format. We're going to be starting with the questions that everyone submitted during registration. If you have a question and you're listening live, you can go ahead and send that in to us. Also, if you would like clarifications on one of the doctor's answers, go ahead and send us questions about those as well. But for now, we're going to go ahead and jump in and get started. Dr. Levine, first, I want to ask you about the different roles that a surgeon and an internal medicine specialist play in diagnosing and treating tumors. Dr. White alluded to this, but can you tell us how the different specialties can come together in managing tumors?
Well, I'd like to echo what Dr. White said. You know, oftentimes various skin lesions and things will come in through the dermatology service, and the surgeon will play a role at biopsying some of those, especially the larger ones if they end up being tumors. And then a lot of the treatments, besides having some, surgical debridement or surgical removal, will have chemotherapy involved as well. So it's usually a team effort, at least here on removing tumors. That's kind of my job, and then some of the aftercare, especially the chemotherapeutics, the internist and dermatologists also play a big role in that.
Okay. And Dr. White, do you have anything to add?
No, I think Dr. Levine said it very well. Thank you.
Okay. Dr. White, our next question is for you, and it's from Melissa in Maine, and she wants to know what kind of growths or tumors warrant a call to our vet.
I would say that any lump or bump that interferes with function, such as movement over a joint or eating, any lump or bump that has an open sore that doesn't heal, and also any lump or bump that continues to grow. And one of the best ways to determine how rapidly something is changing when you're looking at the horse every day is to take a photograph, put a ruler or some measurement device next to it, date it, and then you can take another photograph later on, and that way you have a very precise record in what this mass is doing. And that's also something that's very helpful to your veterinarian when you have them come and examine the horse.
And Dr. Levine, I have a question from Sandy in California, and it's the big question on sarcoids. What causes sarcoids in horses?
I wish it was an easy answer, and I'll try to sum it up. We're not exactly positive of everything revolving sarcoids. Sarcoids are one of the most common equine skin tumors. We see a lot of it. But when it comes to what exactly causes it, there's a lot of research out there, and some of the current theories are that it's a mixture of either a wound or some sort of trauma to the skin that allows a virus in, bovine papillomavirus, and like papillomaviruses in people, they can transport a tumor-like growth. There's also some evidence out there that the genetic makeup of the horse makes them predisposed to being able to get that infection. So it's a little multifactorial, that it's probably viral initiated through maybe some sort of skin wound, fly bite, etc., and that horses are more or less susceptible to that virus. And that's kind of the running theory nowadays.
So, Dr. Levine, if a horse has a sarcoid, is it likely that that horse will get more sarcoids?
I'd say that sarcoids in general, horses can get multiple, and I think that once you have a horse that's predisposed to getting sarcoids, if they have a wound or an injury somewhere else, oftentimes they can get sarcoids there. So I do think that some horses are more predisposed to getting sarcoids, and depending on how robust their immune system is to it, some horses get sarcoids much worse than other horses. So some horses will get one small one, where some horses will develop it all over.
And Dr. White, could you describe to us a little bit what sarcoids can look like and how we can differentiate them from other possible causes of tumors?
Well, sarcoids can masquerade as a variety of presentations. There is actually 6 classifications of sarcoids based on their visual appearance. They can be flat and hairless. They can look like a wart, a sort of cauliflower, hard keratinized growth. They can be a big mass that is actually under the haired skin, and all you see is the mass, but the hair and skin over it looks normal. They can look like granulation tissue or proud flesh, and they can be any combination and permutation of those presentations. As Dr. Levine said, every horse is different, and some horses will have multiple sarcoids that grow rapidly, and other horses will have 1 or 2 flat or little bumpy ones with some hair loss that may be stable for years. And I think that's another reason why keeping your photographic record is a good plan as far as trying to characterize what that tumor is actually doing in the horse.
So to that question of finding out if it's definitively a sarcoid, what options do horse owners and their vets have to figure that out?
The definitive diagnosis is made from histological evaluation of a biopsy. And as we go into different treatment modalities, many of them really shouldn't be tried unless you're absolutely positively certain that you are treating a specific tumor, a sarcoid or any other tumor. And as Dr. Levine says, that's a lot of what he does at Penn, is he's biopsying tumors so that they can be diagnosed microscopically.
And that leads us to our first live question of the evening. And Dr. White, I'm going to give this one to you. Chris is listening live, and she has a mare that developed an occult sarcoid during pregnancy. Are there certain treatments that should be avoided for a nursing brood mare?
Probably.
It's a good question, huh?
Yeah, Probably not, but it depends on what the treatment is. I don't know what the distribution, for example, of cisplatin, which is a chemotherapeutic agent that's often used either injected in an oil immersion or placed in the tumor in a biodegradable small bead. It is dispersed from the tissue, but I would probably have to look into that. Jump in here, Dr. Levine, if you know what the elimination profile of like cisplatin is, whether it's passed in milk or not.
I'm with you in that it's probably a very low risk for some of the chemotherapeutics, but there are other sarcoid treatments that don't involve chemotherapeutics that can be used safely in pregnant mares for sure, whether it be surgical removal with cryotherapy or laser therapy. We do a lot of the autologous vaccination, which also would be absolutely safe in a pregnant mare. But it's one of those things. I agree with Dr. White. I'd have to look into it a little more, but I'm always on the cautious side and would probably do something that's one of those non-chemotherapeutic routes in a pregnant mare, or wait till she foals and then take care of it.
Yeah, exactly.
Yeah, and so Chris's question is about the nursing foal, and I'm wondering if a sarcoid were to pop up during pregnancy, when would there be an urgency to take care of it if there is a foal? Is that something that could wait until after the foal was weaned? Dr. White?
It depends on how rapidly it's growing. If it's an occult sarcoid that's nickel sized and it has lots of hair and maybe a few tiny bumps in the skin, you can probably wait. Characteristically, occult sarcoids and the varicose, the really small varicose ones, are typically slow growing. I've owned horses myself where I've looked at occult sarcoids for years on end, and they never really grew more than 1 millimeter or so a year, and if they're in a benign location, I've let them be. So I don't think that's a problem as far as if it's that type of sarcoid. If it's one of the fibroblastic ones that looks like granulation tissue or an expanding mass under the skin, that's a whole different story. And this is the difficulty when we talk about how can I treat it, because treatment is very dependent on the type of sarcoid, on the circumstances of the horse, and on, in many instances, on the expertise of the veterinarian that's working with you with your horse. We all have different talents, and many of the treatments, it's somewhat of an art still. I think Dr. Levine is the world's expert in the tumor removal and then treating that piece of tumor and then putting it back in the horse as a means to stimulate immune response, but not everybody could maybe do it as well as him.
I don't know about that, but I'll say thanks.
Dr. Levine, with that being brought up, can you explain to us a little bit about that work you're doing and the prospects for that in the future in treating sarcoids in horses?
I mean, quickly, I didn't come up with the idea. I heard about it at an Association of Equine Practitioners meeting where someone had tried removing a sarcoid, modifying the tumor and injecting it back into the horse to create an immune response. And the more research I did into it and thinking about how well vaccines work for papillomaviruses, like this bovine papillomavirus, it was intrigued me. And I tried it on a very challenging sarcoid of mine about 8 years ago. And lo and behold, all the sarcoids on the horse went away. And I was very surprised by it, to say the least. And we've done it in a lot of horses now and published our research this past year on the first 20 or so horses that we did it on. And it does seem in some horses, and again, as Dr. White said, the circumstances around the different types of sarcoids, how many they are, do play a role. But we've been able to get close to a 70% response rate where we remove one sarcoid and all of the sarcoids in the horse go away about 6 months later after the immune system kicks in, which is exciting work. But as soon as you see that any treatment of any disease has 12 to 13 different types of treatments out there, it means that none of them work great. So it is still a bit of an art on what people have used successfully, what they're comfortable with. And I usually still use a variety of treatments on sarcoids in addition to the autologous vaccination, whether it be surgical debulking, cisplatin, Aldera cream. There's lots of treatments out there, and I will still use a variety of them along with the autologous vaccination.
Okay.
And the other thing I think before we close is be very wary of wounds that initially heal and then break open. And also, if you are treating any skin tumor, a recheck examination by your veterinarian every 3 to 6 weeks is also very important, so that if they do reoccur, that appropriate therapy can be initiated sooner rather than later.
So, Dr. White, we have a question from our live audience. Alex wants to know if it will be possible to have a vaccine against bovine papillomavirus in the near future. Do you have any updates or any knowledge about that research?
Yeah, it's not the whole replicating virus like you have if you have a common cold and it's a replicating virus and then you sneeze it off on somebody next to you and then they get the cold. What they find in the sarcoid cells is the epitope of the bovine papilloma virus, which essentially has an effect on cell growth regulation and thus production of the tumor cells. And there are a variety of people that are working on various avenues as far as developing a vaccine, but I don't know that you're going to see this anytime soon. And one reason for that is, although if you have a horse with a sarcoid, it's very important. In reality, less than one horse out of every 1,000 ever has a sarcoid. And the reality of research is funding. And so although the viral epitope influencing of cellular processes is an important area for not just horses and sarcoids, but a whole variety of tumors, I'm not sure that a specific horse vaccine is anywhere close to being available.
Okay. Dr. Levine, we have a follow-up question from our live audience. Celeste is listening, and she wants to know where she can find your published research.
That was published in the Canadian Veterinary Journal, I believe, in February of 2016.
And I believe, Celeste, if you go to thehorse.com and you search for Dr. Levine's name, you will find the summaries that we have done on his research as well. So go ahead and take a look on thehorse.com if you're looking for an overview of his research. But if you're looking for the in-depth stuff, go to the journal. Let's go ahead, and Dr. Levine, the next question is for you, and it's from Marjorie in Ontario, Canada. And she wants to know if all gray horses will end up developing melanomas. And is there a way to predict how aggressive or numerous the tumors will be?
I wish there was a way to predict how aggressive and numerous they will be, but there is not currently a way to predict that. And just like sarcoids, as Dr. White stated before, some horses will have small melanomas their entire life and never have an issue, and others will be small for a long period of time and then grow rapidly, and it's hard to predict how they're going to react. And all gray horses do not develop melanomas, although the gene that codes for horses to become gray is also involved with coding for melanomas. So melanoma in horses, I get it often where people can be very terrified because melanoma in people can be extraordinarily deadly, as well as melanoma in dog can be very deadly. Many gray horses, and I think the last numbers that have been up there are somewhere between 70 to 80% of gray horses at some point in their life will develop melanomas, even if they're small ones that you don't even notice. oftentimes is not. It can be, very dangerous to a horse depending where they develop and how they develop, but most of the time they can be more of a nuisance than they are deadly. And depending on where they are, having your veterinarian look at them, and again, as Dr. White said, that photographic, you looking at them every day can be a little deceiving, but if you take pictures either, every couple of months just to see what they look like, it's easier to compare and see, are they growing, are they not growing? And keeping track of them in a photo journal is really a great way to go when you're dealing with gray horses and melanomas.
Okay. I have a helper who has pulled up, Dr. Levine, the URL for our coverage of your research on the horse. So if anyone's listening and is interested in that, it's at thehorse.com/37236. So go ahead and take a look at that if you're interested. We have another question from our live audience. Dr. White, I'm going to give this one to you. Changing subjects a little bit to warts. So Cheryl's listening live and she wants to know, how do you get rid of warts in horses?
Well, warts are also caused by a papillomavirus, but this virus is an equine papillomavirus. Most horses that have warts have them on their nose and their lips, and they may crawl up other parts of their face and maybe on their chest. If they're less than 3 years of age or equal to 3 years of age when they get warts, the vast majority, way up there in the 90-some-odd percentile of them, will resolve on their own within 3 months. There is and has been what I kind of call equine legends in the past of various uses of the bovine papilloma vaccine and of crushing a certain number of warts on the animal as aiding in resolution of the warts, but both of those methods have been shown not to work in controlled scientific studies. If you have a horse that has a very large number of them and they're getting up to be 5 or 6 years of age and they've persisted for a long period of time, then that's a whole different story. I'd like to know what our listener is referring to. Is this a young horse that she has?
Okay. So Cheryl, if you're listening, go ahead and let us know if you're talking about a young horse or an older horse. I know from my own personal experience, it's like your yearling that you're just about to go start showing in halter, and then they get these horrible warts on their face before you want to take them to the horse show, or every young horse in the barn gets them within weeks of each other. Is that, Dr. White, a typical experience for horse owners?
Yes, if you've got a barn full of weanlings or yearlings, it is transmissible, and flies play a big part in this, as I imagine that humans, as far as handling these horses and grooming utensils and everything else, could play a role, but probably flies, because the virus, just as in sarcoids, has to have a way into the skin, and it is very disconcerting when you have planned a show career for your youngster, but at that age, in a couple of months, they resolve on their own.
So once they resolve, does that horse have an immunity to the warts in the future then?
Yes, they don't come back.
Okay. And we've heard back from Cheryl, and Cheryl says that her horse isn't one of these youngsters. She has a 9-year-old, and they just showed up, the warts did, about a month ago. So does that change your answer at all, Dr. White?
Well, in that case, if the horse is 9 and it has a number of these proliferative cauliflower-looking little bumps on it, I would highly recommend that she have her veterinarian take a couple of those off and have them evaluated histologically to find out if they really are warts due to the equine papillomavirus. There's a variety of molecular methods now to not only look at the cells, but to look at viral etiology as well. And so that would be the first step, is to find out if that's really what they are, if that hasn't been done. And then, I'd hate to prejudice her to what her own veterinarian might do, but there are a number of immunotherapies that that are used sometimes in sarcoids, and that would probably be the way to go.
Okay.
At least would be my first guess.
Dr. White, Dr. Levine has already touched on that there are some genetic predispositions in horses that might lead to them being more likely to end up with tumors. Linda in Oregon wants to know, are certain or specific breeds of horses more susceptible to developing tumors?
As far as sarcoids go, yes. In the literature, you can find that Arabians, Appaloosas, and quarter horses are overrepresented in the population of horses that have sarcoids. In the case of quarter horses, that's a little iffy because there's such a greater number of quarter horses in our country than any other breed. But one thing I'd like to say about the immune system is we tend to think of the immune system as being this entity. And I think people have the idea that it could be one way or another, but the immune system is very, very complex. And just like none of us look exactly alike, in the same way, a whole variety of minor differences in expressions of the immune system and how it reacts to foreign infectious agents or foreign proteins can be very variable. And the more we learn about genetics, the more we realize that it does have an influencing role. But in the case of virally induced tumors, it's a combination of factors. So I will say this, that if you have a horse that is one of those that is covered with sarcoids from one end to the other, or gets warts and they persist for 6 months, that if you have progeny out of that horse, you're probably more likely than a horse with none of those problems to have offspring with the same problem. And that is related to the genetics of the immune system. I say that because I've had families of horses that I've followed through generations that tend to have the same type of skin problems.
Interesting.
Can I add something on that?
Yeah.
Absolutely.
I would agree everything that Dr. White said. The other thing when it comes to breeds of horses more susceptible to tumors is it depends also on the tumor type. So other tumors, I see plenty of squamous cell carcinoma around the eye, and that's definitely breed related to what they call color dilute breeds, or Appaloosas, Belgians, and draft horses that don't have as much color or pigment around their eye, where they are more sensitive to that, which is a sunlight-initiated tumor. So I'd say certain breeds of horses are definitely more susceptible to sarcoids and melanomas, but when you're also talking about other tumors like squamous cell carcinoma, for sure there is a breed predisposition.
And you mentioned
any horse that has unpigmented skin, pink skin, where the hair is thin, are susceptible to squamous cell carcinomas.
Yeah, and Dr. Levine, you mentioned Belgians, which have that sorrel coat color with a light mane and tail, and halflingers. I have some experience with halflingers having squamous cell carcinomas in their eyes too, and my understanding from my vet was that the halflingers too have are more likely to get the squamous cell carcinomas. So
they're definitely on that list.
Yeah. So what recommendations do you have for those horses then? Is it as simple as putting a fly mask on them to try to protect them from the sun?
And sunscreen, as silly as it sounds.
And I want to say that the best sunscreen is a zinc oxide-based sunscreen, and not some of the human ones, which can be very irritating to human skin, and some of them are very irritating to horse skin. So a zinc oxide-based sunscreen. And there are actually a couple of horse sunscreens out there now. Mm-hmm. Kinetic makes one, your sponsor.
Yes. I was just thinking that. I know they do. They have a good one.
There you go.
Because I have a bald-faced quarter horse that uses it on his nose. So, Dr. Levine, our next question is for you, and it's from Liz in Arizona, and she wants to know if there are any new treatments available for melanomas in horses.
There are. So, again, when you're talking about the actual treatment of melanomas, and you could list a dozen of different treatments, it usually means that none of them work great. But there's new research out there now. There's been another autologous vaccine that was developed many years ago that I have used over the years, and there's two new vaccines out there. There's a melanoma vaccine designed for dogs called Oncept, which has been used recently for melanomas. It's fairly expensive, and the research is still young in it, but that same group is developing, and it's not quite at the market yet. I think they're another year or two out, but a horse melanoma vaccine, and they're in clinical trials with that now. So I've been chomping at the bit to get a hold of a sample of it. But these are vaccinations, again, trying to get the horse's immune system to attack melanoma cells. Besides that, there's also been pretty good advances, not only in chemotherapeutics, but localized radiation therapy for various tumors. So I'd say that when you're talking about melanoma, there's exciting stuff coming out on the melanoma vaccines that are out there, but it's still early. We're still a couple years away, and then once it comes out, you're another couple years away before you have some good science behind it.
Yeah, I know a woman who breeds Andalusian horses and has a gray stallion, and she's very excited about the prospects of having a vaccine because she has beautiful horses.
She may not like it when she sees the price.
They're very nice horses.
The other thing is, and when we talk about these vaccines for tumors, you have to realize they're not like vaccines for tetanus and West Nile virus, where you give them in advance of the disease so that the disease never gets started. The vaccines in particular that are developed and are being developed for melanomas are agents that are asking the immune, they are putting in DNA of a tyrosinase enzyme, which is important in tumor growth, that is slightly altered and tagged to the melanoma cells. That's the autologous part that Dr. Levine was talking about. And then they, in turn, attack the tumor. So it is something that you do after the tumor has developed and not before. I just wanted to make that very clear. The Oncept dog vaccine has been used in horses. The jury is still out. There has been anecdotal reports. We have listservs that veterinarians talk to each other about different things, and there are reports that in some few horses on Oncept, the tumors actually grow more aggressively. So the science is not all done yet, as Dr. Levine said.
And I have not had a lot of experience with it. I've used it once or twice, but realistically, I haven't had a lot of experience with it because the jury is out on whether or not it works or makes them worse, and the cost is outside of the majority of my clients' price range.
Okay. Yes, the Immune FX autologous vaccine out of the Florida group is, I think it's $2,600, and I think you probably have that by the time you buy the injector and give 4 doses of the Oncept. So,
correct.
It's in the, and that's just for the drug. That's not anything else. So one thing I wanted to mention for the old horsemen in the group, at one time I was taught, I don't know, Dr. Levine is a lot younger, but at one time it was thought that you shouldn't surgically remove melanomas because, quote unquote, you would make them angry and they would then become malignant. And I think that has been totally debunked. And so surgical removal of melanomas that are around the anus and interfering with passage of manure, for example, or are in the, in other areas that are accessible, surgery is an option for giving that animal more time, if nothing else.
I would agree with that. I mean, a lot of people are always worried about them becoming malignant, and I don't think our treatment makes them malignant. Sometimes if you don't remove all of them, you can, what they say is activate them to grow a little bit faster. But in my experience, if they're causing a problem and need to be removed, debulking them still makes the most sense.
So when you're talking about them, quote unquote, going malignant, can you explain what that would mean and what that would look like? Because I know that I find it confusing talking about equine cancer, because I hear you mentioned with melanoma, you think of melanoma in a human, and it's very scary. Where I'm in a barn that has lots of gray horses, and they have melanomas, and they're monitored, and but it's not necessarily a immediate death sentence for the horse. So, Dr. White, can you touch on that a little bit, what it means when you say something goes malignant?
When you have a malignant tumor that is capable of metastasis or spreading throughout the body, and there are melanomas in horses that do become malignant and the tumor spreads throughout the body, usually like cirrhosis surfaces of internal organs like the spleen or the lung or the kidney, but they can go anywhere. I've had a couple of horses that ended up with melanomas inside the brain and the spinal cord. Years ago, there was actually done at Penn looking at is there something about these tumors when we evaluate them histologically, or any changes in clinical biochemical parameters in the horse that can predict when these tumors are going to aggressively change into a rapidly growing and traveling cell, and the answer is no. But a lot of times, an old gray horse, or even some of the most dramatic cases I've had, not even gray, they're presented for weight loss and ill thrift, and you find on ultrasound that they have tumors within the thoracic or abdominal cavity. Now, down the road, there's research that is looking at how to decide in a laboratory whether it's a malignant tumor or not. A benign tumor is one that grows and stays right where it is, doesn't go anywhere. And for the most part, that's what sarcoids are. They're classically described as benign skin tumors, that they don't travel through the body system to other organs. And so it depends on who you read, how many of them turn into malignant tumors and how many don't. But our clinical experience is a great number of horses have slow-growing, not rapidly metastasizing melanomas, which is very different from humans, where they tend to metastasize widely and really fast, which is what makes them so scary.
Our next question is for you, Dr. Levine. It's from Alex in our live audience. And Alex wants to know if you can advise on the success rates for cisplatin for sarcoids. Do you have a figure?
Well, so it depends on which study, and this is the hard part when you talk about research in horses in general. As Dr. White alluded to, funding is always hard, and then also the number of horses in each study is hard. So the first study in horses on cisplatin said they had a 100% success rate, and everyone was like, yay! But after that, more studies have come out, and it's not quite that high. And it turns out that if you look at the data out there on cisplatin and sarcoids, it has worked the best as the first line of treatment. So cisplatin drastically works worse when you've tried multiple things and then try cisplatin. And that's probably true for most of the tumor types that we have, is that if the first thing works, it's going to work better than if you tried multiple things and then try it. But probably if you look at it now, depending again on the size of the sarcoid, how invasive it is locally, how many there are, cisplatin has been shown to be very effective in like the 80+% for single small sarcoids. When you get up to multiple sarcoids, its efficacy goes down. When you get up to larger sarcoids, it goes down as well. I don't know if that helps and if that answered the question.
And that is very well said. The other thing is, all cisplatin is not created equal. the papers that talk about the great success, we're using a concentration of the cisplatin that's no longer available. If you're using it, you need to use it in a emulsion in an oil, because aqueous cisplatin is dispersed out of the tissue really fast, and the reason for the oil or the reason for the beads is to hold that cisplatin in place over a prolonged period of time so it has a chance to work. And it gets back to the art. In one paper it says it's 80% successful. That may not be the case for every single person that tries it. There's a learning curve, as well as all those other influencing factors, and that's kind of the problem with this tumor, that there are probably 15 legitimate ways to try and do something about them. You can't do it in sound bites. That might be more than ought to be digested, but I mean, it's, and the other thing about cisplatin is it's a cumulative chemotherapeutic drug. And so when using it, you have to be very careful. The humans handling the drug have to be very careful because of its cumulative effect.
Okay. We have a follow-up question to our earlier discussion about squamous cell carcinoma. Dr. Levine, Stacy M. is listening live, and she wants to know if there are any new treatments available for squamous cell carcinoma in the eye.
In the eye. So the hard part with squamous cell carcinoma when you're talking about the eye is how invasive it is and how quickly you caught it. So oftentimes you'll see it first in the third eyelid, which is what protects the eye when the horse closes it, and that can be surgically removed. But squamous cell carcinoma can be sneaky, and oftentimes it can spread in the eye. And there are various treatments out there that are being used now with chemical photoablation, so injectable, basically a dye that you inject into tumor cells. It gets picked up by the tumor cells, and then when shown a light, it will kill the cells. That's some of the stuff that's being done now in the human side that we've dabbed with a little bit, as well as various chemotherapeutics that you could use to try to slow down squamous cell carcinoma. Unfortunately, with advanced squamous cell carcinoma, oftentimes what we end up doing is removing the eye and the tissue around it to remove the whole tumor to keep it from spreading to the bones around the skull and along the face. So squamous cell carcinoma, when caught early, can be cured with surgical removal, but when caught late, sometimes you're talking about a very aggressive removal of the eye and the surrounding tissues.
The early ones that involve the eyeball, the conjunctiva or the limbus, where the sclera joins the clear part of the cornea. Mitomycin C is a topical agent which has shown it's been very helpful in quite a lot of cases. The photodynamic therapy that Dr. Levine referred to, I know at Texas A&M they do a lot of it and it's very successful, but it's right up there with the vaccines for melanomas. It's a very expensive treatment, very successful.
And very, very challenging and expensive to even have the equipment. There's a huge learning curve with that.
Yeah, so a horse would have to go to a referral center with experience. This gets back to everything we're talking about isn't equal in everybody's hands. You have to have some expertise. And then I imagine you still have beta radiation probes at Penn.
We don't anymore. Instead, actually, we're moving to, instead of the beta radiation, which used to be a probe you put in there, is actually now electrical radiation, which is a radiography-generated radiation, local brachytherapy.
Right. So there are a number of things that can be done, and as Dr. Levine referred, the longer you wait and the bigger and more invasive it is, the harder it is to deal with.
And when you do have squamous cell carcinoma on the limbus or cornea, I could tell you that surgical removal of those can definitely be done with combination of mitomycin C, but that should really be done by someone with experience with ocular surgery, either a surgeon or an ophthalmologic surgeon should really be when they're talking about corneal squamous cell carcinoma.
Dr. White, during registration for this event, we got a lot of questions about sarcoid treatments, asking about frankincense oil, turmeric, and some other options that are on the market. We have a live question from Chris, and she wants to know if there are any quote-unquote natural treatments that are showing to be effective against sarcoids.
You have to sort of define what a natural treatment is. For example, and Crest toothpaste was in there, I believe, too, and that one's an easy one because toothpaste today contains fluoride, which is a heavy metal, and if you put heavy metals on the top of any particularly open excoriated cells, they stop those cells. They kill the cells and they stop them from proliferating. It's an old treatment was heavy metal use on proud flesh. As far as other topical agents such as frankincense, that was initially looked at by Martin Furr at Virginia Tech quite a number of years ago, but it just fell off the landscape. And I think the reason is that when you try to get down and use some controlled studies of it on known tumors that have been biopsied, that it didn't show effectiveness. I don't know about turmeric. I would like to say that there are a number of sarcoids that 10% of all of them in the literature have been reported to regress on their own. And so you have to wonder if what you're doing has actually had a cause and effect of two events occurring at the same time. People have put anything and everything you can think of on sarcoids, and none of them have risen through the ranks of being scientifically evaluated to be effective in that 60 to 80 or greater percent. I think that's the best way to say it. I do think it's possible with some caustic or necrotizing agents to cause as much or more harm than you are good. So you have to be very careful. And I assume that Chris is referring to natural ingredients as being benign topical agents that don't hurt anything. You could argue that Exteria is a natural treatment because it's zinc chloride and a derivative bloodroot. Bloodroot's a plant. Zinc chloride is a chemical that exists. But it is a very caustic agent, and that's how it gets rid of sarcoids, because it causes cell death. And you can do a lot of harm with Extera as well as have some resolution of some sarcoids. So that's a long answer to say, not that I know of. Dr. Levine?
Well, I think the autologous vaccination is natural because you're taking the natural product and using it against it. But I always tell people when they're like, "Can I use something natural?" I'm like, "Well, you know, poison ivy is natural, but I wouldn't wipe it on my skin. Cobra venom is natural, but I wouldn't inject it into myself." So when it comes to a lot of the natural compounds out there, there's not a lot of research that goes into them, and when the research does go into them, oftentimes it doesn't pan out. And I've seen everything wiped on sarcoids, and I've seen everything wiped on wounds to go that far. And everyone claims their thing works, but what I like to see is actual numbers in controlled research environments with unbiased people doing it. And oftentimes that stuff doesn't pan out. And if it did, we would all be excited and have something to choose. But
we have a question from our live audience for you, Dr. White. It's from Pat, and Pat wants to know if there are any nutritional considerations or diet recommendations for horses that are prone to tumors. Cindy is also listening live, and she wants to know if you have any recommendations for supporting a horse's immune system to maybe help them fight off these tumors. Dr. White?
I think if you have a very well-balanced diet, and I think the best way to do that, if there's any question, is to work with a nutritionist that is trained in equine nutrition. I deal with an awful lot of inflammatory skin diseases in which we're trying to decrease inflammation, and that's where the one supplement that's been shown to be helpful is the omega-3s. As you know, there are some immune stimulating products on the market that are injectable, and they have had various, and they're used when you're trying to treat a tumor of some kind, and they have had some effect on of different tumors. The one I'm thinking of is the old regressin, which has now become immunocytin and is marketed for dog mammary tumors. Used to be very effective in sarcoids. But as far as a diet with a nutritional supplement, as they tell us in human medicine, the very best thing you can do is to make sure that all the elements in the normal diet are there. And the thing that I worry about is when people have a variety of supplements that they are adding to a commercial diet, then you may have things that are out of balance. And very rarely do people, when they're analyzing a diet, look at the hay, at the concentrate, whether or not it's a commercial mix, what's in that commercial mix, and then all the different supplements that are added. So I'm dodging the question a bit, but there isn't a supplement out there that you're going to give a horse that is going to make their immune system something that the genetic makeup is not there for.
Okay. Dr. Levine, we have a question from our live audience. Lori has a gray quarter horse that is rapidly growing melanomas on his sheath. Her vet says that they are on the inside as well, plus around the anus. Now the horse has a lump on his throat and is coughing. Is it possible that it has spread to the horse's respiratory tract? And she has a follow-up to that question is, when do you know that it's time to euthanize your horse that has melanomas?
Okay. I will tackle it in parts. So melanoma is often in the perineal and prepucial area, but the other place where it's often found is in the guttural pouches around the throat and in the lymph node chains kind of around the throat in the throat latch, and they can also travel down in the jugular groove down the neck lymph node chains as well. So it would not be surprising to me if the lump that they're feeling is also a melanoma, and if the horse has developed a cough, it would be worthwhile having a veterinarian look, scoping the upper airway, looking in there to see if there's melanomas, if there's something else causing the cough, because it may just, the lump may be there as a melanoma. Oftentimes horses will have melanomas in that area which are not causing a problem, and the ones that are in that area are the most difficult to treat, so oftentimes we don't treat those. The ones in the prepuce and anus, I'd say, should be treated, especially in an older horse, if they're causing problems with defecation and urination. I see plenty of melanomas in that area where the horse is passing feces fine and is healthy, and in that case, in a 20-something-year-old horse that's not having any clinical signs, I wouldn't rush to need to do surgery on that. If they've been growing slowly, they've been there for a long time, and the horse is otherwise healthy. The harder question is, when is it the right time to euthanize your horse? Is a very personal question, and it's something that veterinarians deal with every day. And something that's always helped me is I usually tell people to make a list of things that their horse or dog or anything enjoys very much, whether it be going out for walks or this or eating and things like that. And when more of those things your horse can't do than can do, it's telling you that their quality of life is diminishing. If your horse is having a lot of trouble defecating and it's not surgically removable, you know, is it time? It's a very personal choice, and it's something that, you know, your veterinarian, your trainer, everyone that's with you can help you decide on, but it's something you have to be comfortable in, knowing that we have the ability in our profession to ease suffering in horses who are prey animals and don't really understand what's going on, if that's helpful at all. Dr. White, I don't know if you have another opinion on that.
Yes, and I always tell people that I think you've very well said that to consider the animal's quality of life as the most important thing. And if the horses that have melanomas associated with the parotid glands or the guttural pouches or the lymph nodes, and have them around the perineal area and have them in their sheath, very often those horses also have internal tumors. And one of the things that you'll see is weight loss in those horses, just like you see weight loss in people with cancer. So that's another indication, despite their diet, they're losing weight, or despite their appetite. This can tell you a little bit about the quality of life.
Dr. White, we have a question from our registration questions, and it's a very practical question. Anne in Florida wants to know how to protect sarcoids and melanomas that are in places where blankets or tack might rub on them. What recommendations do you give your clients?
I think that if you've got blankets, I'm trying to think where they would be rubbing, anywhere on sarcoids or tack. As far as having to use that blanket or having to use that piece of tack, probably I think that true wool sheepskin, not the synthetic fleece, but the true wool washable sheepskin over an area like an occult or varicose warty looking sarcoid is helpful. If the tumors are open, if they're draining melanomas that drain the black necrotic tissue, or if they're excoriated or granulating looking sarcoids, then I think you're in a position where you're going to have to come up with ways to cover those, and I think tack in particular is probably not indicated over anything that's an open wound. But you may be able to use, I actually had this in my own horse. He had an occult sarcoid right across where the crown piece of the bridle or the halter went, and that's what I did. I used the true wool sheepskin, and it prevented it from being further irritated to the point that it became a wound. In a blanket situation, you may be able to sew pieces of the washable wool, true wool sheepskin in areas that, so you don't have rubbing if it's around the collar of the blanket or at the chest piece of the blanket. That's what I'm thinking about.
And Dr. Levine, when then is it an option to surgically remove these tumors if they're in the way of the tack or blankets?
It's probably one of the most common reasons why smaller tumors are removed is I see a lot of small tumors that will do excisional biopsies, remove them and biopsy them at the same time, and oftentimes it's in the way of a girth or rubbing between the legs, and it's oftentimes on those small ones where we could remove them fully, let the area heal, and then treat if there's underlying tumor left there with adjunctive chemotherapeutics. Usually it can be curative. So probably one of the most common reasons why I'll do surgery is tumors, whether they be sarcoids or melanomas that are interfering, getting rubbed and opening back open. And so I think it's a reasonable reason for a surgical removal of those tumors if they're interfering with the horse's daily routine.
Okay. Well, we are actually out of time for this evening, and my helper who is sorting through questions says that there's still 35 questions from our live audience that we haven't gotten to tonight. But it was a great conversation. For everyone who's listening, if your question didn't get answered, I recommend going to that resource that I mentioned at the beginning of the hour, thehorse.com /skin tumors. Also look at some of Dr. Levine's research that's on the horse. We have lots of resources on there. Or go ahead and send them in. We're always looking for questions to answer in both the magazine and online. And if you have photos, because I know these are very visual type things, if you have photos that you want to send to us, we're happy to get those and see if we can help get some answers for you. Before we close out, Dr. Levine and Dr. White, let's start with Dr. Levine. Do you have any closing thoughts for our audience?
No, I hope everyone enjoyed and we got some questions answered. Just my closing conclusions would be, don't forget that tumors should be biopsied by your veterinarian to see what they are. Don't ever always believe what what the claims of some supplement or cream says. And it's a partnership between you and your veterinarian to get the right diagnosis of what the tumors are and make a treatment plan that works for you and your horse.
Okay. And Dr. White?
I think that was very well said, and the follow-up to that, I think, is if you have a definitive diagnosis and a treatment plan and the tumor is removed surgically or resolves with other therapy, don't forget to have your veterinarian regularly recheck the animal to be sure that it doesn't reoccur, because you'll want to start therapy sooner rather than later in reoccurrence.
Well, unfortunately, that's all the time we have this evening. I want to thank Dr. Levine and Dr. White for joining us and answering all these great questions. I want to thank our sponsor, Kinetic Vet, who brought this to everyone tonight for free. And finally, thank you to everyone who submitted your questions, both during registration and while listening live. Next month, join us. We're going to be talking about the science behind supplements, and I know that's going to be a really interesting and popular topic with all of you who like to join our Ask the Horse Lives. Until then, from all of us at the Horse, have a great evening.